Hello, I'm Brian Connor. I'm one of your faculty members for NRDNP 858, Evidence-Based Practice, Quality, and Safety. And the topic of this first video and the topic of your first discussion question will be to relate the differences between research and evidence-based practice. So I'm just going to spend a couple of minutes giving you a couple of pointers on that. When you go to respond to the discussion question, you need to elaborate, not just repeat what I've said during this video, but to actually elaborate on it a little bit, and we'll phrase the question in a way that will help you understand what it is we want from you. But basically, I just want to spend a few minutes describing to you the differences between research and evidence-based practice. We'll throw in a little bit and talk a little about quality improvement as well, but it's vital that MSN, DNP students both know and understand the importance of evidence and evidence-based practice and how that differs from research. So let's discuss that a bit. Research is what researchers and PhD students, and eventually those with a PhD, conduct. They conduct research, and they do that with very rigorous methodology. They conduct either quantitative, qualitative, or sometimes what's called a mixed methods approach to conducting research. So quantitative research is typically what I think of things you can count, things you can quantify, ways that they use statistical processes, very rigorous methods and statistical processes to be able to offer reliability and validity of their results and findings. Qualitative research is something we do to find deeper meaning, and that's typically done through interviews or focus groups. Not as easy to quantify the results, but nevertheless still strict methodology and approaches to conducting research. Research, the main purpose of research is to generate new knowledge. That's what we call it. When you generate new knowledge or validate existing knowledge that where not a lot of that knowledge exists yet, so trying to add to the knowledge base. But the whole purpose of research is to explore. We think of research as exploration. You develop hypotheses and you test hypotheses, and you are typically using something testing something that's not been done before. You're trying to figure out better ways of doing things, but you're typically doing that, people who conduct research are doing that with unknown methods. The other part that's very different for researchers is that they typically use randomization of subjects. They have intervention groups and control groups to try to really reduce any potential bias. As opposed to evidence-based practice, when you're conducting evidence-based practice projects, when you're looking at evidence-based practice, it's all about finding the best evidence available and then using that evidence, translating research results into practice. That's the goal of evidence-based practice. So you're not testing new methods, trying to develop something. You're not exploring new interventions. You are looking for what's been done, what's been tested, often through research, but that a large body of knowledge now exists and best evidence is available. Often that's through evidence-based practice guidelines. Sometimes it's just through recommendations or suggestions from people like places, the CDC, AHRQ, some of the main organizations in our country that try to help focus on improving health outcomes for people. So the purpose of evidence-based practice is to translate evidence into practice. So you go and you find the best evidence. That happens through searching the literature, not necessarily doing research, but searching the literature, finding the best available evidence, and then translating that into a specific site. What we understand is that even though something may be considered an evidence-based practice, it doesn't always fit in every particular site, whether that's a primary care practice or a hospital setting, whatever it might be. And so you don't just implement something because you read it in a journal and it's been shown to have the best evidence. It's still tested. And so evidence-based practice projects are the place where you test evidence-based guidelines. You try to find the best evidence, translate it into the practice in the site where you're at, and see if it works well there before it becomes standardized. So this is what's vital for MSN and DNP students to understand. And as you go to begin thinking about how do you, as we teach you, how to search for best evidence, how to find that evidence, how to write up something called a state of the science paper, which informs your eventual practice improvement project, certainly for the DNP students, but even for the MSN students, finding the best evidence helps. That's the way we phrase it, is it helps inform your eventual potential intervention that you might suggest or recommend. And that's what MSN students will be doing in a paper, a manuscript that will be published prior to, or submitted for publication at least, prior to your graduation. So just a brief couple of things there about the differences between research and evidence-based practice. Quality improvement plays into this as well, in the sense that there are principles and processes used in quality improvement. And often what DNP students end up doing is what we consider sort of a hybrid evidence-based quality improvement project. So it's quality improvement where we use systems thinking to try to improve systems or processes that will eventually lead to improved patient outcomes, but you do that using the best of evidence available. So I hope this has been helpful. I'm going to do more videos throughout this course. One of the things I hope you'll find in this, Sharon has done podcasts in the past, and those are great, and I don't want to recreate those, so you'll be hearing Sharon's voice. I like to use the video, and we're just still learning how easy it is to use YouTube video technology so that you can sort of see my face as well as hear what I'm having to say to you. So I hope this is helpful. We'll look forward to hearing how you evaluate our use of YouTube and podcasts in getting you this information. Hopefully this has been helpful, and I look forward to seeing your responses to your first discussion question on the differences between research and evidence-based practice. Thanks very much.